let's go to the Department of Youth Affairs where we have the director, Melanie Brennan, standing by. We really wanted to just catch up with her as we had a bombshell of an interview yesterday with Major Anton Uggan from the Department of Corrections. And I don't know if I know you guys saw it in the news, but it was actually the last interview of our show yesterday. And we had no idea that there's an outbreak at the Department of Corrections. And that's what I think we're going to call it. They've had 26
positives, and then as a result of that, there were 40 or so officers, staff that had to be quarantined for 14 days. So yesterday he was down 68 people because of COVID, and then they started testing yesterday. They're going to continue testing today, and then more testing next week. So I guess everybody is going to get tested over at DOC. So
Right.
we actually should be checking in with them today.
I just dropped a line with him.
Okay.
But you know what to me, the scariest part is since the beginning of the pandemic, one of the recurring themes that we've heard, not just from the guys at DOC, but from the doctors and the public health officials, is if COVID-19 got into the prison, it'd be very serious. And
because you can't really, it's difficult to like social distance, I want to say.
yeah.
So.
And so now we're having that conversation. COVID-19 is in the prison, and they did the testing yesterday. So I'm just wondering how many of these results that we saw last night were from that testing. We don't know. We're going to find out. 8:10. So let's go ahead and bring Melanie on in the KUAM News Zoom room. Good morning, Melanie. Thank you for joining us.
Good morning. Good morning. Half a day.
I guess we just start by catching up from our last conversation. I know that you guys had some positives, and you were in the process of testing the staff over there at DYA. What can you tell us? What has developed since our last conversation?
I think since our last conversation, I did report that we had 10 youth residents that had tested positive of our 17 in the actual facility. And so that number has remained the same. All 10 residents are still in isolation. All 10 residents are receiving monitoring checks. We did partner with public health isolation facility nurses, and they do come out to check on the clients, as well as partnering with the Guam Behavioral Health and Wellness Center. They do provide 2 daily checks, one in the evening and one in the morning for our youth residents. And it's because the Department of Youth Affairs does not have an infirmary, and we don't have full-time medical care. And so when the administration recognized that, we were basically having an outbreak, they really wanted to have a healthcare presence besides our youth correctional officers to help supervise these COVID positives.
What about the officers?
So initially, we reported that I think at our last conversation, we had, I think I had reported that we had 5. So since we last spoke, 3 additional positives have shown up, and all 3 positives, 1 positive actually was tested initially with the kids, and it returned negative at the time. And so, there's a 2-week incubation period. And so public health had said that, the chances of, the officers that work in the isolation unit, would be really high. And so we had to step up the healthcare protocols. Many of them have already been fit tested for the N95 respirators that you see the nurses wear in isolation facilities. And so since the last time we spoke, we've been monitoring the staff as well, and 3 additional positives did show up. And so what we're looking at is, because we're basically at a shelter in place, we're looking at the next, we got our first positive on October 17th. And so you would imagine that you take about a month to see the positives. And because our latest positives with the kids, I think our latest positive was a youth service worker. And so you want to take that date, which was November 4th, and it probably could extend until December 4th. And so that's when we really, really need to be careful. We need to monitor everybody's symptoms coming in and out. And right now it's just the officers that are cycling in and out of DYA.
Mm-hmm. Are any officers on quarantine?
So right now we had 2 other officers who are on quarantine because of other contacts. And so obviously we don't want to introduce another source into DYA. So through contact tracing, family members were told to isolate. And so these officers are not presently sick, but are on quarantine.
I know that you guys.
So I'm sorry, go ahead.
No, go ahead. Did you want to?
I was just saying that, you know, it has always been part of our contingency strategy to ask for assistance from DOC. And so I know that they're going through their own issues right now, but early on we had asked for 2 additional DOC officers to help us. And so we still have those 2 officers working with us currently. And of our 8 officers that were positive, 1 has already returned to duty, was cleared by public health. So it's really only 7 officers that are out. All of our officers that were utilizing the government isolation facility have been cleared to home isolate. And so we're expecting, you know, in a matter of days that they'll be back to work as well. We were very fortunate that only 1 of our officers really did need hospital care for a couple of days, and that was because of breathing difficulty. None of our residents, youth residents, had those kinds of experiences. In fact, all of the residents had mild symptoms, and last check was last evening, and there are only 2 residents that are exhibiting symptoms right now, and those symptoms are mild. They've lost their sense of taste and smell, but they're still eating. So we're really, really hopeful, and we're glad that the number of youth residents testing positive has kind of stymied at this point.
So you feel that you guys have contained the virus at DYA?
I do, but at the same time, I'm cognizant of the community spread, and I know that it is only our officers right now that cycle in and out. So that will always be a concern, Chris, and I think that's DOC's concern. And how they're mitigating it is they're trying to just capture it before it enters the inmate population, because as you saw with DYA, it just spread.
Right.
And so it's slower. I'm sorry, go ahead.
No, you know, crime doesn't stop, or it hasn't stopped since COVID. What about new admissions into DYA?
So with new admissions, again, like I explained earlier, part of our mitigation strategy was to reduce admissions through actually taking a look and seeing who really is coming in through DYA doors. Remember, incarceration for youth should be like the last resort. We want to reserve incarceration for the most violent, unmanageable youth. And so we're working really, really well with our partners, and we continue to work really well with our partners. I have gotten calls at all times of the day and night, and we've been able to manage placement outside of DYA. Now, I did have a conversation with Sergeant Maggie from JIS and with Chief Ignacio, and we are prepared. If there is any violent offender, if there is any repeat offender that just cannot be managed, we have a contingency plan within DYA that will that we're ready to deploy.
Can you give us a little bit more details about how you would handle that situation?
Well, yeah, so as you know, because of juvenile justice efforts that kind of started with the court, and it really had its impact on the reduction of youth admissions to DYA. For example, in 2015, we had like 80 to 100 youth residents. That was the population per day. And so prior to COVID coming in, we had a population of about 25 to 30 kids. That was the daily population, and an average admissions to DYA on a monthly basis of 30 kids. Okay, since COVID has started, we've managed to reduce that population to about 5 a month. And so that is, you know, and then working with the people, the youth that we had, and working on alternative placement in the community has worked so that we have a small population, meaning we have some wiggle room to play with. And these dorms are isolated. They're not, although it's a congregate facility and they used to eat in the galley, we've stopped that since we stood up the isolation facility. So I do have a dormitory that is identified for new admissions.
But they're having
that is not connected to the isolation or the quarantine facility.
Melanie, when you said you were cognizant of the community spread, the widespread transmission of the virus, outside of your facility, what type of words and guidance do you give to your staff when they, for their lives outside of work?
Well, Chris, everybody's afraid of the virus, including my staff. And I really have to give kudos to them for continuing to show up on a daily basis, knowing that we have the virus in the facility. They are true COVID heroes also. They work alongside other public safety heroes, and we know how important it is to stay within our bubble. We do briefings before and after every shift, and part of the message is that you have to stay within your bubble. You have to keep yourself safe so that you can come to work, and keep yourself safe so that you can go home safe to your family. So the protocols, the masking, these things were in place since March. And if anything, we're just enhancing it with additional PPEs. And again, we have such great partners, and we could not have done it alone. We've gotten a lot of assistance through BSP, the Bureau of Stats and Plans, the emergency funding. We've gotten our staff just recently fit tested for the N95, the half-face respirators. We've got Guam Fire Department always on the ready to come and decontaminate what other areas that we might need to stand up. And so we started very, very aggressively with contingency strategies. And so we're at a place where, I can safely say that so long as we don't introduce another source, we've got this current outbreak under control.
I had watched one of the interviews one of our reporters did with Crescinda Uggan, and one of the things she mentioned was one of the officers there had to be hospitalized. And I just wanted to follow up on that officer's condition, if they're okay.
Yes. So of the 8 officers, only one needed breathing assistance and needed some, I guess the oxygen levels are, you want them to be above 95%. And so he was in the isolation facility at the time, and it was detected that his oxygen levels fell below that. I don't have the exact percentage, but he did need to go. He wasn't on a ventilator, he just needed oxygen. He stayed at the hospital for a couple of days and returned not to the government quarantine facility, isolation facility, but to home isolation. So he's doing much better. Thank you for asking, because everyone wants to know about the youth residents, and honestly, it has been, for us, that demographic, our youth residents that have it, they really did fall within that demographic that seems to exhibit like less serious symptoms and are doing better. Our concern is obviously for the health and safety of both the residents and our staff, but right now it's the staff that are really struggling to get better and to come back to work. And so it's a constant I guess prayer that they do recover well. And again, like with this virus, it's like you could be feeling really, really well day one, and the next day, the next minute even, you might need to go to the hospital. And so again, we're not there yet. I'm hopeful, but I'm still very, very worried. It is a critical situation in the community and now within our congregate setting.
Are your do a significant number of your staff have the comorbidities or diabetes or any of the other conditions that may cause people to struggle with the virus?
I think with every government agency, we have our share of individuals who have health issues, and so again, we've tried to mitigate that by moving some to admin and putting, like, for example, the one returnee that came back after he tested positive and recovered, he's in the isolation unit now. He's assigned to the isolation unit because he's got the antibodies. And so we're just trying to strategically place our staff. And even at the same time, we've stepped up our disinfection, our sanitizing efforts so that we can try and protect everyone. But again, it's everybody's personal responsibility. I know that a lot of people just put it on the government, but it really is going to take everyone to get through this.
Amen.
Right. Well, thank you guys for all you guys are doing. I mean, you're not one of those agencies that can actually telework when it comes to, working at DYA. So.
Unless we want to take the kids home, but that could also be challenging.
Right. Yeah. And also, thanks for your accessibility, Melanie. I like that we ask you to come on. You're like, yep, sure, what time? Appreciate that.
Yeah.
Okay.
Be
Thank you
safe.
too, and take care.
All
Okay,
right,
be
take care.
safe. We have virtual brown rice and what is it? Brown rice trumpalado? Yeah. We have virtual brown rice trumpalado in the KUM News Zoom room. If you